Oh, did you get my
Can I
ID?
stay right here?
Yep.
Okay.
No, you can't stay there.
Please notes.
I'm with the plan. I'm with the plan.
Okay.
You're fine.
I've been working in a children's mental health facility for a little over 4 years, and primarily they work with underprivileged youth. Working here has changed my view on mental health and how we deal with the ones that are the most vulnerable populations. One of the most important things that I remember while working is that not all of these children are in the foster care system, but a lot of them have dealt with poverty, parents with mental illnesses, and abuse themselves. Prever states, although there are a number of pupils who may belong to vulnerable groups whose circumstances may be contributory or exacerbated by factors in mental health of young people, those including pupils of Black and other ethnic minorities, refugees and asylum seekers, pupils with learning difficulties, and young people who have experienced chronic childhood illnesses, children with alcoholic or drug-dependent parents. I've witnessed some of the effects that the foster care system has on children. Although I do not directly work with the children, I have seen and heard some of the stories about their situation. Today I will be telling you a little bit more about the foster care system and the correlation of mental health. Foster care is a temporary placement away from the parents when the state has deemed that the household is unsafe for the child. According to Prever, almost by definition, young people who find themselves in care have already experienced a wide range of difficulties, including the loss of a parent or abuse of some kind, and many come from dysfunctional homes. Many times in the foster care homes, the children have already experienced behavioral issues that many children in normal homes do not experience. Now that you know a little bit more about the foster system, I will give you more information on the foster system and mental health. The most common topic of foster placement is within the provider home. The people that become foster parents have to become licensed in the state in which they reside. They have to take classes in order to learn how to provide for the children properly. According to research, foster children are more likely to experience mental health issues as well as physical health issues that normal household children may not experience. Norm states, in addition to familial risks for behavioral and emotional problems, foster placements itself may be a risk factor for such problems as adjustments to a new family and placement disruptions. However, the link between foster placement and child problem behaviors is not well established, and the causal direction of this relationship is unclear. Talk in the psychological community have suggested that the temporary placement does not favor well for the welfare of the child. Evidence from Barber reports, even more surprisingly, only children that begin in unstable placements but have settled down have shown signs of psychosocial deterioration up to an 8-month point. It seems that even though there is deterioration for the psychosocial well-being of the child, it stops at an 8-month point. In relationship to the mental health concerns of the child placed in foster care, there is also concerns for physical health as well. Children that are placed in foster care have greater health risks such as height, weight, and dental health concerns. I see many of these children that come into my work. A lot of them have no other place to go. Many of them are on Medicaid, and a lot of other counseling services and psychiatric clinics don't provide services for Medicaid recipients. Carbone states, most come from backgrounds of chronic poverty and with associated familiar dysfunction and social problems, and enter foster care because of some form of abuse, neglect, or parental incapacity. There are a lot of contributing factors that could be the reasoning behind mental health in foster care children. Carbone later states, children in home-based foster care have poorer general health, more frequent exhibiting behaviors of aggression, immature, delinquent behavior, and they're also more frequently experience feelings of anxiety, depression, and have poorer self-esteem than other children in the community. Finally, children in home-based foster care experience more limitations and activities due to both emotional and physical behavioral problems. The last subject I will talk about is foster care children mental health compared to that of normal children. The United States, the United Kingdom, and Australia have had the same prevalences with foster care children and mental health. According to Priver, there are more boys in the foster care system than there are girls. I've incorporated some slides for statistical data that has been collected by Priver. Foster care children are 21% more likely to suffer from emotional disorders than that of 6% of children in normal private homes. 40% compared to 6% from conduct disorders, and 49% compared to 11% with any childhood mental disorder. These problems don't just stop at mental and physical disorders, they stem further into the children's schooling and thriving into their social lives. According to Carbone, there is a great need to provide additional help for these children to lessen the impact of their problems in their personal, academic, and social lives. In the past couple of minutes, I've shared with you my passion for understanding the reasoning behind the greater need to help these children. Although collecting this information is hard, considering the group that is being observed, I hope that I've given you enough information to see the importance of getting these children help. Mental health should be a priority for everybody, but some people don't have the opportunity to get the help they need. And as adults, I think that it's important to inform those that can help to help. Thank you.